Okay, so we're recording the webinar, and when we're done, we'll put it up on our YouTube channel, and everyone that's on the webinar will receive an email with the link to the YouTube channel, and also we'll email you the slide deck so you have a PowerPoint copy as a PDF. So good morning, everyone. It's 10 o'clock, and I decided we'll start right now. The reason we decided to do this webinar is that when I turned 64, which was August, probably the next day I started receiving hundreds of pieces of mail from Medicare carriers soliciting my business that won't even happen for another year. I must have received emails from Anthem Blue Cross, Blue Shield, Humana, Cigna, you name it. I received emails. Received postcards and letters and brochures. For the last 20 years, we've been handling Medicare clients, and we handle about 1,000 Medicare clients right now. Usually we have this presentation as like a one-to-one conversation when people are getting ready for Medicare. However, we decided to put this as a webinar due to the number of people that are turning 65, and also because I realize that if I'm turning 65 next year, everybody I went to high school with is also, and it might be a good way of educating people. The purpose of this is not to solicit business, it's to educate people as to how Medicare works. We usually, before I start, let me just give our webinar disclaimer, which we always do. Our lawyers ask us to do this to make sure that you guys know that we're not lawyers and we're not from the federal government on Medicare. But the idea is that we handle thousands of Medicare patients or Medicare people, and we picked up this webinar information from the CMS, which is the government website, and their booklet on Medicare. United Healthcare has a great booklet on getting started with Medicare. And then Sherry Hyman, who's our Medicare expert, also consulted with me on all the slides to make sure that we were accurate and what we tell our clients is correct. So having said that, we'll start in with our agenda. What we're going to cover today is eligibility enrollment, what your coverage choices are, which are Part A, B, C, and D. Talk about Medicare supplement plans, and talk about annual open enrollment. There's a lot of confusion around Medicare, but confusion has to do with what's Part A, what's Part B, and what's Medicare Advantage, and what's the best for me. And then with Medicare supplement plans, there's 10 options, and what should I take? And then with Part D, which is drug plans, is how do I do that, and when do I do that, etc. So having said that, we'll kick off with who can get Medicare. So U.S. citizens and legal residents can have Medicare, and the legal residents must live in the U.S. for at least 5 years in a row. If you have not qualified for Medicare because you haven't worked enough hours, enough years, etc., you can also buy Medicare. So if you were here for at least 5 years, you can buy Medicare. And what I wanted to say is that we got a phone call last year from one of the members of Fleetwood Mac. It was actually the business manager that said that someone was bringing over their 90-year-old mother to Malibu to live with them, and that they wanted them to have Medicare. But because they were not in the U.S. for 5 years, they couldn't even buy Medicare. So the only thing they could buy for medical insurance would be an individual policy for people that are 90 years old or 85 or what have you, which was $100,000 for a policy that covered $150,000 of benefits. But you get Medicare when you turn 65, if you're younger than 65 with a qualifying disability, and also end-stage renal disease or ALS, which is Lou Gehrig's disease, you can get Medicare earlier than 65. So we'll start out with some helpful tips. There are two ways to get Medicare coverage. One is to get Medicare A and B, and also to buy a supplement plan. And the other one is to do Medicare Advantage. You will pay a share of your costs. People just assume, well, this is Medicare, that we don't pay anything at all. That's not true. You do have a protection for higher out-of-pocket costs that's available through supplements and through Medicare Advantage. There are two ways to get drug coverage. Most people will buy a Part D drug supplement, but other people will take a Medicare Advantage plan, a Medicare Part C plan, and that will have drug coverage included. It's wise to review your choices each year during annual open enrollment. Situations change, where people live change, the drugs they take may change, and it's important to once a year to go through that process, which we're doing right now. You may enroll and make changes in other times of the year, and we'll cover that also. So starting out with coverage choices, and we're going to be handling extensively Part A and Part B and Part C, but just as a summary, Part A pays for hospital stays and inpatient care, and Part B pays for doctor visits and outpatient care. You automatically will receive Part A when you turn 65. You get your Medicare card, you get Part A. But you don't get Part B. That's a choice you make. Yes, I'm going to buy Part B. I'm going to enroll in it. And some people decide, well, I'm going to stay on my employer's plan. I'm going to be working past 65. I have group insurance. I don't need Part B yet. Some people go, I'm going to get Part B anyway, and then there's rules as to how the insurance gets paid and what pays primary and what pays secondary, and we'll talk about that. Last week, though, I had a phone call from a woman who said, my mother needs to buy a drug plan. And she said she has Part A and Part B, but she never bought a drug plan. And I responded with, well, when did she turn 65? Because if you don't buy a drug plan when you turn 65 and you enroll in Part B, then there's penalties. And the penalties for not buying a drug plan are 1% per month. And that adds up. So in her case, her mother hadn't turned 65 2 years ago, which is 24 months ago. So 1% per month over 24 months is 24%. So when her mother buys a drug plan this year, whatever the going rate is for that drug plan, let's say it's $50 a month, for example, for the drug plan, she will end up paying $62 a month for the rest of her life because she's getting penalized. Well, the rest of her life meaning that she gets a 24% increase because of that. Going to the next slide. So the first thing you have to decide is if you need additional coverage. So if you get Part A and Part B, you have the option of getting a Medicare supplement plan to help pay for out-of-pocket costs, and again, a prescription drug plan. You also have the option of getting a Medicare Part C plan, which is a Medicare Advantage plan. And Medicare Advantage plans combines Part A and Part B in one plan. And what happens is you're basically signing over your Medicare rights, your Part A and Part B rights, to a third party. One of the biggest Medicare Advantage carriers in the country is Humana. Another one is Pfizer. But there's other companies that do Medicare Advantage plans only. So when you sign over your Medicare rights to Part A and B, then Medicare pays them and you enroll in Part C. Part C usually includes a prescription drug plan, and it may offer additional benefits not provided by Medicare, such as a health club membership and other various benefits that they may throw in. The problem with Part C is there's a couple of issues. One is it's geographic. It's an HMO. So if you have a Part C plan, you're going to go to that network of doctors. Or if you have a Medicare supplement, it's a PPO. You can go anywhere you want, and you have coverage. If you're planning on moving, it may be an issue if you have Medicare Part C. A friend of mine who lives up in Oak Park has his mother in Palm Springs, and he wanted to move her to an assisted living facility in Oak Park. And she had a Medicare Part C plan in the desert, and they did not have coverage in Oak Park or Ventura County. That was a problem. You can drop your Medicare Part C or change it during the year at certain times under certain conditions, which we'll cover. but it was problematic for them. And then when she bought the part of Medicare Advantage plan originally, it was because it was basically free or almost free to get it. And they never thought about what would happen if she moved. So Part A, as I mentioned, is hospital. It covers a semi-private room, hospital meals, care in ICU, anything that happens in a hospital, it covers. And there's a whole list of things that it covers right there. Part A has some costs. The premium for most people is $0. However, it could be up to $437 per month if neither you or your spouse paid Social Security taxes in the last 10 years. So if for some reason you weren't in the system and you weren't paying Social Security, it could cost you some money. There is a deductible, which means that you pay the first $1,364 per benefit period. The day you enter the hospital and ends when you have been out of the hospital for 60 days in a row. So that means at the beginning of the year, if you go to the hospital, you pay a deductible of $1,364 of your hospital bill. And then the copay in the hospital. For the first 60 days, there are no copays. For days 61 to 90, you pay $341 a day. And after 90, you pay $682 a day during lifetime reserve, and we're going to talk about that in a moment. But if for some reason you're in the hospital for 30 days and you paid your $1,064 your deductible, and then you're out of the hospital for 90 days or 120 days, if you go back in the hospital later in the year, you have that deductible all over again. If you go back to the hospital within 60 days of when you left, then you don't have a deductible. It also co-pays for skilled nursing facilities of zero copay for 1 to 20 days, and then $170.50 you have to pay for the next 21 to 100 days. And then hospice, if you end up going into hospice, it's $5 for each prescription or to manage symptoms. So let's talk about lifetime reserve days. After you're in the hospital for 90 days, you have something known as lifetime reserve days. Lifetime reserve days are additional days that the United States healthcare system, Medicare Part A, will pay for a beneficiary in the hospital for more if you're in the hospital for more than 90 days during a benefit period. Beneficiaries are limited to a total of 60 reserve days over the course of your life. So let's say you're in the hospital for 100 days, and so you pay $341 for days 61 to 90. You pay $682 for the next 10 days, but you've used up 10 of your reserve days. So you only have 50 left. So if you don't go to the hospital for 3 or 4 years, and you go to the hospital and you're in the hospital for over 90 days, then you only have 50 reserve days left. And that's something to be aware of with Part A. Now, supplement plans will help you with that, but that's how reserve days work. Part B, Medicare, covers doctor visits and outpatient care. So figure it this way. Part A covers what you get in the hospital, and Part B covers your hospital, your expenses outside the hospital. Covers doctor visits, even if your regular doctor visits you in the hospital. Your annual wellness and preventive, covers your lab tests and blood tests and x-rays, imaging, medical equipment, etc. Covers physical therapy, diabetes screenings, etc. So just say Part A in the hospital, Part B out of the hospital. Part B costs. Most people pay $135.50 a day when you first enroll. If you enrolled in 2019, it was a little bit less in 2018. You aren't receiving Social Security. Your premiums are billed directly to you, and you have Medicare and Medi-Cal, and Medi-Cal pays for your premium. So you're paying $135.50 per month for most people. A lot of people do not take their Social Security at 62 or 65. They wait till they turn 70. And the reason they wait is to get a higher Social Security benefit. So if you're waiting and you're not paying Social Security, then you have to pay this $135.50 per month. If you're on Social Security, then it's deducted from your payments that you receive every month. Your premium may be less than $135.50 if you enrolled in Part B in 2017 or earlier, and your payments are deducted directly from Social Security. Your premium can be more than $135.50. If your reported income is above $85,000 for individuals or $170,000 for couples, you're not paying $135.50. You may be paying a lot more. And I think, and don't hold me to this, but I think the highest you can pay is like $400 and some a month. So if you're already earning, $170,000 or more, and you're a couple, the government basically feels you can afford to pay more for Part B. Plan B deductible is $185 per year. So for out of hospital coverage, you pay $185 deductible before the benefits kick in. And then you're paying 20% of the Medicare approved amount for most covered services after you pay the deductible, and there's no out-of-pocket maximum. So that means is that whatever the Medicare approved price is for various blood work, office visits, MRIs, X-rays, whatever you go see the doctor for, Medicare's paying 80%, you're paying 20% of the Medicare approved amount. Now, if you're on regular health insurance right now, you might be on an 80-20 plan if you're on a PPO. You might be on a 70-30 plan or a 60-40, but you're not paying the Medicare approved rate. You're paying something that's a negotiated rate that your carrier has negotiated with that medical group or that doctor or that imaging center. So for example, when I go to the doctor and I use my United Healthcare PPO insurance and I pay my office visit costs me $25. The approved office visit to see a doctor under United Healthcare is $125. So my doctor gets $125, of which United Healthcare pays $100. But the Medicare price to see a general primary care physician is $11. So if you're going to on Medicare and the price is $11 right now, you're going to pay 20% of that $11 after the $185 deductible. So the Medicare pricing, costs are a lot less than a regular visit. So for example, if I get an MRI, the cost might be $500 or $1,000 for an MRI under a PPO plan with a negotiated rate with a Anthem or a Blue Shield of United Healthcare, but the Medicare price might be $100. So Medicare pricing is a lot lower than what everybody else has, which is one of the reasons why insurance premiums are so high, because doctors don't really make money on Medicare, and that becomes a problem for them. Part B may charge a premium penalty if you don't sign up when you're first eligible, and we'll talk about that in a few upcoming slides. Part C. Part C is Medicare Advantage. It's basically an HMO. As I mentioned, you sign all your benefits to Part A and Part B, except hospice care, to the Medicare Part C provider. And therefore, Medicare pays them a piece of the pie every single month. They pay them what's known as a capitation fee or a monthly fee to cover whatever you have with that medical group. So for example, if you're on a Humana Medicare Advantage plan, which is advertised on TV almost every 15 minutes right now, Medicare Part A and Part B is turned over to Humana. Humana gets a monthly fee, and you get a Medicare Advantage plan, which is an HMO. It usually covers prescription drugs. It may cover dental exams, cleanings, x-rays. It may cover eye exams, eyeglasses. It may give you wellness benefits like fitness memberships or emergency medical care outside the U.S. The thing about Medicare Advantage is it's for a specific HMO medical groups with your carrier. You can't go out of network. Very important. So let's just talk for a moment. In the country, 65% of people do not take Medicare Advantage. They buy A and B, and then they buy a Medicare supplement and a DUG plan. 35% of the country does a Medicare Advantage plan. Why? Because it costs a lot less money. A Medicare supplement plan with a carrier may cost you $100 and some a month or something, where Medicare Advantage may cost you $0 or may cost you $5 a month. So a lot of people say, oh, I'm going to take Medicare Advantage because I've always had an HMO, or I'm on a limited budget. And they don't recognize that, one, they have to go to doctors and hospital in that network. And number two, but if they ever move away, there could be an issue because that plan may not have coverage. Part C costs, I already mentioned plan premiums may vary. It could be as little as $0. It could be as much as $50 a month. Deductibles, some plans have deductibles, others have no deductibles. Some plans may change deductibles for drug benefits only. There may be copays or may not be copays. So when you look at a Medicare Advantage plan, you want to look at them closely. And they also can have out-of-pocket maximums. So, and during the year, if you do have any out-of-pocket costs that you pay, that you may be limited, and the government limited it to $6,700 for 2018. So I always have a problem with these solicitations for Medicare, whether I get them in the mail, whether on TV. When I'm watching television at night, I see Humana ads, I see Anthem Blue Cross ads, I see Scan ads, I see commercials for a whole bunch of things. United Healthcare, they're running a lot of commercials through ARP. ARP, which is a retirement organization for people over 50. They are basically sponsoring a United Healthcare plan. Why are they sponsoring it? Because they get a piece of the action. It may not be in your best interest to go directly to a carrier and buy a plan, because you want to make sure you're getting a plan that covers what you need, and we'll talk about that in a little while. I think it's better to use an independent third party to evaluate your choices and help you. Part D, prescription drugs. Part D started over 10 years ago, and it covers drugs. Types of drugs most commonly prescribed for Medicare beneficiaries, and specific brand name and generic drugs that are carrier approved on their list. Part D has 4 stages. There's an annual deductible that you have to pay first. Then there's initial coverage where you pay copays up to a set limit, which in 2018 was $3,750. And then there's something known as a donut hole. The donut hole is where you pay a percentage of the cost up to an out-of-pocket limit of $5,000 in drug costs a year. And above that, then you get your drugs free for the rest of the year, or reduced copays. So the thing about Part D is that every single year between October 15th and December 7th, it's Medicare Part D prescription drug coverage enrollment or re-enrollment period. And the important thing to understand is that Part D, the carriers that participate in Part D drug plans, and in the Southern California area, there are like 30 different carriers that have drug plans. They have to have one therapeutic drug in each category that the federal government requires, but it may not be the drug that your doctor prescribed. Or you may have a list of drugs and you choose a Medicare Part D plan, but the following year, some of your drugs changed, and because of that, you may need to look at a different Part D drug plan. A few years ago, I talked to a couple who had an Anthem Blue Cross Part D drug plan, which they had for 10 years. I said, well, why do you have this, and have you looked at other drug plans? And they said, well, when we turned 65, we bought an Anthem Blue Cross Medicare supplement plan, and so our agent said, just buy a drug plan through Anthem. They did that for 10 years. We ran their drugs on the Medicare system, which we'll talk about in a little bit, and we were able to find them a different drug plan that saved them $2,000 a year. So their agent who sold them the Medicare drug plan took the easy way and said, oh, I'm selling Medicare subs with Anthem, just buy their drug plan, it'll cover your drugs. They listened to them, they did it, and it really, in 5 years, they had spent $10,000 on drugs they shouldn't have spent. So it's very important to recognize that every year you have to look at your list of drugs and choose a new plan or renew your plan if that's the best plan for you. Now, if you don't sign up for Part D when you turn 65 and you buy your Medicare supplement plan, there are penalties, as I mentioned earlier, 1% per month. And I mentioned recently that I got a phone call from this woman that said her mother needed a drug plan and hadn't done something for 24 months. Recently, we had somebody call Sherry in our office. They needed a drug plan. They hadn't done it for 10 years. 10 years is 120 months. They had a 120% penalty. So it's very important that you buy your Part D drug plan when you enroll in Medicare. Premiums may vary. Plans may vary what it covers every year. Your maximum deductible on a drug, brand name drugs, are $405. Not all plans have deductibles, however. Coinsurance, some plans may set coinsurance rates for certain drugs or drug tiers. In the donut hole, you will pay 44% of the price for generic drugs and 35% of the brand name cost in that donut hole. And when you get through the donut hole, which is that $5,000 figure, then it'll go down after that. So just to be repeat, you have your annual deductible first, which is $405 in 2018. It'll go up in 2019. Then you're going to pay copays for the next $3,750 of drug costs. And then you get the donut hole. In the donut hole, you'll be paying 35% of those brand name drugs and 44% of the generic drugs. But once you hit $5,000, then everything changes again, and you have catastrophic coverage, and you pay reduced copays the rest of the year. So we'll talk a little bit about Medicare supplement plans. Whoops. I want to cover one more thing on the Medicare drug plan, and I apologize. As I mentioned, every single year, drug lists change. And a senior, whether you're 65, 75, or 85, you are required every year, if you want to get a drug plan, to go on the CMS website, log on to the website, and input the list of drugs you take. I wanted to test this last year because what we do for our clients are that we ask them for a list of their drugs, and then we have somebody here that goes to the CMS website, inputs it into the computer. The CMS website spits out a report that shows the 3 best drug plans for those people in terms of cost and premium, out-of-pocket costs, etc. And then we give our clients a choice of those 3 plans, and they choose one of the plans, usually the one with the lowest cost. But I wanted to test the system. So I went on the website and I went, how does this exactly work? And here's how it works. When a senior puts their first drug in the CMS website, there's 50 mouse clicks. You have to put your name, address, phone number, identifying information, and then you have to put in your first drug. And when you put in a drug, you have to decide what your drug is, the dosage. So for example, am I taking 5 milligrams, 10 milligrams, 20 milligrams, whatever? Am I taking a capsule or a pill? Where do I buy my drugs? Gives you a choice of where you buy your drugs, Costco, Walmart, CVS, Walgreens, etc. But to put your first drug in, it's 50 mouse clicks. And then for every additional drug, it's 5 mouse clicks. So if you were a senior on 10 drugs, which is not unusual for seniors, if you're on Medicare and you take 10 drugs, you have about 95 mouse clicks to get your drugs, to get the report that shows you where you can, which plan is best for you. The CMS computer will tell you those best plans, and then you can make a decision and enroll. We decided over 10 years ago that seniors really, some seniors are savvy on the internet, some are not. My 85-year-old mother-in-law is on Facebook. She's on Instagram. She does face chats with grandchildren. But for her to input 10 drugs with 95 mouse clicks and get the right dosage, right pill or capsule, etc., it's challenging. So what we do here at our company is we input it for them, and that makes it easier. Agents, just so you know, if an insurance agent is certified to do Part D, you have to get certified every single year and take courses. We make a whole $3 a month on Part D drug coverage. So it's not a money maker. We consider it our charity work. Every year in November, December, we help seniors get the right drug plan. But be aware that you can't just take a drug plan when you turn 65 and never buy another drug plan. Drugs change, prescriptions change, doctors change what drugs you're on, and drugs that are covered by carriers change. Okay, going to Medicare supplement plans. Medicare supplement plans help pay some of those out-of-pocket costs that Medicare doesn't. You remember I said it's an 80-20 split? Medicare supplement plans can cover that 20%, can cover some deductibles and copays. There are 10 standardized Medicare supplement plans. Each plan has a label. The plans are A, B, C, D, F, G, K, L, M, N. The reason they're so E or H or I or J is there used to be, and those plans were discontinued and new plans took their place. So these supplement plans can help you with your Part A and Part B Medicare deductibles, your copay, your coinsurance. It could cover some provider excess charges. It can help you with hospital stays. If you remember, I said that you get 90 days in the hospital and then you get 60 lifetime reserve days. And if you use them up, you only get 9 days in the hospital. But a Medicare supplement plan can help you cover up to 365 days in a hospital. It also helps with blood transfusions, the first 3 pints, and foreign travel emergencies, as Medicare Part C Advantage plans cover. I want to talk about traveling for a moment. What most people don't understand is that Medicare supplement plans and Medicare Part A and B and Medicare Part C Advantage plans only cover medical emergencies when you travel out of the United States. So it's always recommended that you buy a a travel health insurance policy through one of 2 or 3 companies when you travel. So if you're going to go outside the United States and take a cruise, travel to South America, travel to Europe, you have Medicare for emergencies, but nothing else. So if you fell down and you sprained your ankle, you got the flu, a respiratory problem overseas, it's not 911 emergency, you have no medical coverage. But you can buy a travel policy with $1 million limit, with no copays, no deductibles, no anything, fairly inexpensively. So as an example, although I'm only 64, if I spent $10,000 and went on a cruise with my wife and we're spending $10,000 on a cruise, we may get, for a 2-week period, buy a travel policy with $1 million coverage for under $300. So if you're already paying $5,000 for a cruise, it probably makes a lot of sense to pay $300 or $250 or whatever the dollar amount is for some travel health insurance. If you buy trip cancellation insurance, that does have some travel health insurance in it, but it's not $1 million. And it may have deductibles and copays. So you want to separate trip cancellation and lost baggage coverage with health coverage if you travel. So insurance companies set their own Medicare supplement plan premiums. Plans that provide more coverage generally have higher premiums. Premiums may vary from carrier by carrier, and premiums may change from year to year. So on a Medicare supplement plan, on open enrollment, you may want to look and say, hey, should I change my Medicare supplement plan this year or not? Most people don't. I'll tell you, but the average length of time that someone keeps a Medicare supplement plan is 11 years. And Medicare supplement plans, people usually buy them when they turn 65 and they don't change them. So the next slide talks about what your coverage options are in combination. So Part A and Part B, when you turn 65, Part A automatically, Part B you have to buy. You can do Part A, Part B and just buy a drug plan, but don't buy a supplement plan. You can buy a supplement plan, number 3, Part A, Part B, Medicare Part D, and a supplement plan. You can buy a supplement plan and never buy a drug plan, which is what happened to that woman that her daughter called me the other day. You can buy Medicare Advantage Part C, where Part D is included, drug coverage is included. Most of the Medicare Advantage plans that I've seen in California have drug coverage included, but sometimes they're not. So with Part C, sometimes you have to buy a drug plan. So those are kind of your coverage options. Moving on, enrolling in Medicare. So when can I enroll in Medicare? There's an initial enrollment period. The initial enrollment period is a 7-month period. The 3 months before you're 65, the month you turn 65, and 3 months after you're 65. It begins 1 month earlier if your birthday is on the 1st of the month. So for example, if your birthday was August 1st, it wouldn't be 3 months prior, which would be July, June, May, but it would be April. So just be aware of that. The general enrollment period every year is October 15th to December 7th. At that time, anyone can join, switch, or drop Medicare plans, and your coverage always begins January 1st. You may use the general enrollment period to enroll in Part A and Part B, or both if you missed it originally. But if you missed it originally, there could be a penalty for Medicare Part B. Medicare Advantage open enrollment has changed in 2019. It's from January 1st to March 31st. So during this period, you can switch to a different Medicare Advantage plan. You can disenroll in a Medicare Advantage plan and just go back to A and B. But if you go back to A and B, you might want to get a supplement and a drug plan. But you can only buy a drug plan between October 15th and December 7th. And a Medicare supplement plan, you can get October 15th to December 7th. But if you leave Medicare Advantage and you want to get a Medicare supplement plan, you may be medically underwritten and you might get turned down. And that's another reason why you might not want to buy a Medicare Advantage plan, because if you ever want to get out of it, besides geographically, you might get medically underwritten. So between October 15th and December 7th is annual general open enrollment. Then Medicare Advantage, you get an additional January 1st to March 31st. Medicare Supplement open enrollment is 6 months after the month you turn 65 or older and enrolled in Part B. So I turn 65 next August. I can buy Medicare Part B the 3 months before, the month I turn 65, the 3 months after. But your Medicare Supplement plan, you can only buy 6 months, the 6 months after you turn 65 with no penalties. So if I turn 65 in August, I can buy a Medicare Supplement plan in August, or I can do it in September, October, November, December, etc. There's a special enrollment period if you work past 65. A lot of baby boomers are not retiring at 65. I plan on working till I'm 70, and I'm on a group health plan. I have friends that work for companies that they're going to work past 65, and they have a group health plan. So you're not required to buy Part B when you turn 65. As I mentioned, Part A you get automatically. So the month after the last month of your employment or your employer health coverage. So if you have a group health coverage, you terminate it from that. You have 8 months to enroll in Part A and Part B. And you have 2 months to enroll in Part C if you want to do Medicare Advantage and a drug plan. Most people that I know, when they leave a company and they retire, they're immediately buy the Part B and Part D drug plan immediately so they don't have any penalties or miss the deadlines or what have you. But you do have this timeline. And once in a while, people, turn 65, they don't buy Part B, they still work for a few years. But if you are working, what you might want to do is look at how much it would cost you for Part B and your drug plan and your supplement versus what you're paying. If your employer doesn't pay 100% of your health care coverage, then you might not want to stay on the group plan if it costs you less to be on Medicare. And here's a caveat, very important. An employer cannot force an employee to go on Medicare. So if you work for a company and you turn 65, they can't come to you and say, oh, you turned 65, we want you to take Medicare. Against the law, they can't do it. Illegal. If they do it, there's penalties, there's fines, you can litigate. There's no reason you can't do it. We took over a group 12 years ago that did not have a retirement policy. A group of 125 people, we did their group benefits, and they had 15 people that were 66 to 85. They're a university. and their professors had no retirement age. And so they were paying thousands of dollars for those coverage for each person every month, and they couldn't force them to go on Medicare. What they could do is have a Medicare information session like we're doing today and tell people what their choices are, but you can't force them to go on Medicare. Okay, let me make sure I cover everything. Okay, so if you do buy Part B and you do have an employer relationship and you're still working and you're on group coverage, if your employer's under 20 employees, like my company, we have 16 people. So when I turn 65 next year, I'm going to stay on my group health plan. Because we have under 20 employees, Medicare Part A will pay first. And if I buy Medicare Part B, they'll pay first. And then my insurance, my PPO insurance, will pay secondary. So when you go to a doctor and you have a claim for services, Medicare pays first, my own insurance pays second if my employer's 20 employees or less. If my employer's over 20 employees, then the employer pays first, their insurance, and Medicare pays second. And that's very important. And we run across this when employers cross over that 20 employee level, because what happens is Medicare will find out they're over 20 employees and they'll bill them for a bunch of past services. So just be aware that does go on. Next, late penalties. Part A. Well, people who pay a premium, most don't, will pay an additional 10%. But Part A, for the most part, you get it automatically when you turn 65. About 3 months prior to turning 65, you get a letter saying it's Medicare time. And at that time, 3 months before you turn 65, that will be the time that you might look at, should I buy Part B, should I not? Should I get a Medicare supplement, should I not? Should I get a Part B? That kind of thing. Part B, 10% penalty for each full 12-month period you delayed enrollment. So if for some reason you turn 65, you're not working, you're not on any other group coverage from an employer, but you decide not to buy Part B, there's penalties. Part D drug, we already talked about the penalty. 1% per month if you don't buy Part D when you enroll in Part B. So very important. Changing your coverage. As I mentioned before, Medicare open enrollment is October 15th to December 7th each year for January 1st. In addition, you can join, switch, and drop Medicare Advantage and Medicare drug plans during that period. And also Medicare Advantage has that special period, January to March, that starts next year for the first time. During the special enrollment period, you may join, switch, or drop outside of open enrollment. But in general, you have 2 months after after the month of a qualifying event. So here's what that means. If you're on an employer group coverage and you're over 65 or your spouse is, and you lose that coverage, and you lose that coverage because your spouse stopped working. So let's say, and in my case, my wife and I own our company, and she started the company, so we both have our individual medical plans. But let's say we're on a joint plan, and my wife's 5 years younger than me, so when I turn 65, she's going to turn 60. So when I turn 65, if I decide to drop my coverage, it's a qualifying event for her because she'll lose her group coverage. She's got 2 months to enroll in other health insurance, and I have 2 months to enroll in Medicare. So that's kind of how that works. Lastly, it's important that you understand what your needs are when you're turning 65 and you're getting Medicare. And what I mean by that is that a lot of people, as I mentioned, this couple that I know that bought health insurance from an Anthem agent, they bought an Anthem Medicare sup plan and they bought a Medicare drug plan through Anthem Blue Cross. I don't know if that was the right choice for them at that time. So you need to look at, when you do this, look at what coverage works best for you. And what I mean by that is, how often do you go to visit the doctor? Do you go once a year for a wellness exam? Do you go quarterly because you're taking meds and your doctor wants to check? If you take medications, do you take them regularly and are they covered under the plan you're going to join? Do you have a particular doctor, hospital, pharmacy that you want to use? Because if you do, then a Medicare Advantage plan may not be right for you. On the other hand, if you want to go to a particular doctor, hospital, pharmacy, then a Medicare supplement plan is important and a Part D drug plan is important. But you want to make sure that that pharmacy, you can buy that drug at that pharmacy. The most important question is, does your doctor accept Medicare? Very important, and here's why. As I mentioned before, a doctor gets $11 for an office visit through Medicare, but $125 from United Healthcare. They may get $150 through Blue Shield, for example. So doctors are not really excited about taking on Medicare patients. The payments they receive are so low, whether it be a regular visit, an extended visit, tests that the doctor might run, they're getting bare minimum for that. And because of that, they may not be willing to take on new patients. So before you turn 65, you want to make sure that your doctor will allow you to stay with them when you turn 65. Now, most doctors, if you're already their patient, you've been their patient for 5 years or 10 years or 15 years, they're not going to kick you out when you go on Medicare. They'll just accept you. They just may not accept new patients. So, for example, my 85-year-old mother-in-law, she wanted to change doctors. She went to 3 doctors, but said no before she found a doctor that said yes. So do you have other health coverage through your employer or a union or through the military? That may affect what your Medicare needs are. And then the question, would you rather pay less in monthly premiums or pay less when you receive care? Some people say, I'd rather pay the little as possible monthly, and a Medicare Advantage plan might be great for them. It's an HMO, they're in a medical group and a network, they pay nothing or very little, and they have coverage, and they're happy. Other people will say, you know, I'd rather pay more for my monthly premium, be able to see my doctor, go to my hospital near what I want to go to, like Cedars-Sinai in LA, or the City of Hope, or Providence hospitals, for example, rather than the Medicare Advantage hospital that, you know, is affiliated with my Medicare Advantage HMO. So you have to decide what you want to do. And I think it's really important, and you know, this whole webinar today is an educational webinar. It's not to sell product. It's not for us to solicit business. But I think it's very important that when you're turning 65 or when you're making these choices each year, that you talk to an expert who's certified in Medicare, and you make the best choice for you. And you know, for example, I mentioned that we're doing this webinar because I'm turning 65 next year, and I thought it was important based on all the letters I'm receiving. But I know that our Medicare expert here, Sherry, that if someone calls up and says, hey, I'm turning 65, Sherry has a long conversation with them, gives them a Medicare booklet, talks about all their choices, all the carrier choices, all their drug choices, and let them make an educated decision. So we believe in having people make educated decisions at the time of purchase. So we don't represent just one company. So my warning at the end of this webinar now is that if you're turning 65 or you have an agent, make sure they represent every company in the marketplace, every drug company, every Medicare supplement company, etc. Regarding Part D drugs, we represent everybody in California that sells Part D. However, 2 years ago, a new company came on and said, you know, they're going to sell Medicare Part D, but they're not going to use agents to help them. And it turned out that if you weren't taking any drugs at all and you wanted to buy Part D, they were your best choice. And so we would tell our clients, listen, we'd like to help you with your Part D, but ABC company here is in the market now, and it's the cheapest, and they don't work with agents. You should go with them directly. And we gave them the link to the website. So be aware that you want to make educated choices. And now what I'm going to do is open up to questions. If you have a question, we have a chat box. Type in a question, and hopefully I can answer that question. I am not the Medicare expert in our company. Sherry is. And just in case you wanted to chat with Sherry, here's her email address and her phone number and her name. Does anyone have any questions? I'll wait a couple minutes. Okay, in that case, then we'll wrap it up for today. Thank you for attending the webinar. As I mentioned, we're going to send you a link to the YouTube video and send you a copy of this PowerPoint. If you ever have any questions about Medicare, no obligation, give Sherry a call or an email. She'll be happy to answer your questions, especially after January 1st, because right now she's working with our 1,000 clients trying to get them all set up for the next year. So thanks again. Can you email us your documents? Yeah, we are going to email the slide deck along with a link. So we're pretty good there. Great. Thanks a lot, everybody. Have a great day.